Lawrence Kohlberg's theory of moral development categorized school-age children as conventional morality, which means that they base their moral decisions on the rules of society and their expectations. They're more focused on prioritizing the approval, acceptance of others rather than focusing on punishments and rewards and how it will affect.
Erickson's theory on psychosocial development describes how individuals progress through 8 stages of development from infancy to adulthood. School-age kids fall into stage 4, which is industry versus inferiority. The main task on this age is developing a sense of competency. During industry phase is when children strive to master new skills and tasks. For example, a child completing a complex puzzle and feeling proud. While during inferiority is a failure to develop these skills and result in feelings of inadequacy. For example, a child struggling with math and feeling discouraged compared to peers. On this stage, children learn to build social relationships and developing self-esteem through accomplishments.
Piaget's theory places school-age children in the concrete operational stage. This occurs after the pre-operational stage and is characterized by several important cognitive milestones. Children begin to understand that quantity, volume, or mass remains the same even if the appearance changes. So, for example, they can recognize that water poured from a tall glass into a short, wide glass is still the same amount. Children develop the ability to group objects based on shared characteristics. They can sort and characterize things by color, size, shape, and other criteria. This refers to the ability to arrange objects in a logical order, such as from smallest to largest or from lightest to heaviest. In this stage, children begin to understand that certain operations can be undone or reversed. For example, they know that if they add a number and then subtract the same number, they'll return to the original number that they started with. Unlike younger children in the pre operational stage, school age children can focus on more than one aspect of a situation at once. For example, they can consider both the height and the width of a container when determining which one holds more liquid. School age children can think logically about concrete objects and events. However, they do tend to struggle with the abstract or hypothetical situations. Concrete operational children benefit from learning experience that involve manipulation of physical objects. So, for example, they can learn best through activities like counting blocks, sorting objects, or conducting simple experiments. Encouraging logical reasoning and problem solving skills help them develop their further thinking. So, math, puzzles, and games that involve logical sequences are ideal at this stage. Lessons that should be tied to real world experiences that make sense to children in their daily lives are ideal. Abstract concepts are better understood when they are linked to tangible real world examples.
Between the ages of 7 and 11, children grow at a steady pace. On average, they grow about 2 to 3 inches each year and they gain approximately 4 to 7 pounds annually. This consistent growth sets the stage for the more dramatic changes that will come with puberty in the early teen years. During this period, children also start to lose their primary teeth, and these are replaced by their permanent teeth. This is an important milestone in their physical development. For girls, physical changes begin to indicate the onset of puberty. One of the first signs is the development of breast tissue, which can start as early as age 8, but typically happens around ages 9 to 11. Along with breast development, girls also begin to grow body hair, such as pubic and underarm hair. A significant change for boys is the deepening of the voice, which is a direct result of hormonal shifts. Along with this, body hair also starts to develop. As children grow, their physical abilities to become more refined. Children develop increased strength in their large muscle groups, such as their arms and legs. This improvement in strength helps them excel in physical activities like running, jumping, and climbing. Additionally, their balance and coordination also improves. Small muscle coordination improved dramatically in school-aged children. With practice, they become more skilled at precise tasks like writing neatly, drawing accurately, and performing other tasks, such as buttoning shirts or tying shoelaces. These improvements help children gain more independence and confidence in everyday activities. By age 9 or 10, many children can write more clearly, participate in crafts or arts, and have better control over their hand movements. Hormonal changes during the school-aged years not only affect physical development but also emotional growth. They begin to experience more intense emotions, which lead to mood swings. These shifts are driven by increasing hormone levels and the onset of puberty. As a result, children may feel more sensitive or have more extreme emotional reactions than before.
For the interview part of the physical assessment, we want to obtain biographical data, which is just information about the child, their name, address, phone number, as well as information about their parent or caregiver. Usually, a questionnaire is given to gather information about the child's nickname, feeding habits, food likes and dislikes, allergies, sleeping schedule, and toilet training status. For the chief complaint is the reason for the child's visit and a complete explanation of what brought the child to the healthcare setting. For history of present health concern, we want to discover the child's needs, about their current situation, including their symptoms, when they began, how long the symptoms have been present, their intensity and frequencies, and any treatments that they have been taking. For their past medical history, we want to know information about the mother's pregnancy and prenatal history, any chronic illnesses, immunizations, and health maintenance, as well as hospitalizations and injuries. For family health history, the parent or caregiver provides information regarding their family health history, and the nurse uses this information to do any preventative teaching with the child and family, as well as any current medication. We also gather information about their lifestyle, including current grade level of the child and academic performances, as well as any behavior seen at school, any concerns, family structure, what does that look like for the child. We also gather developmental level and ask parents if they have any questions regarding their growth and development milestones, as well as have if the parent has observed any behavior that is concerning. We also assess for their nutritional history. This is the best way to understand a child's health and growth pattern. We discuss the types of foods and portions of food consumed. We ask questions such as family's usual meal time. Do family members eat together or at separate times? Are there any distractions such as TV or electronic during meal times? How often does the family of your child eat out? During their physical assessment, we check their vital signs. Their blood pressure, systolic is somewhere between 97 to 120. Their diastolic is between 57 to 80. We check their heart rate, which is usually between 75 to 110 beats per minute. Their temperature, which normal is 98.6 degrees Fahrenheit, but their temperature for childless age can vary slightly, and a temperature up to 100.4 degrees Fahrenheit is still considered normal. We also check their respiration rates, which are about 18 to 25 breaths per minute. We also observe for general status, which means observing general appearance. The child's face should be symmetrical, their nutritional status, hygiene, mental alertness, body stature, body posture, and movements. We also know any psychological status and behavior. We record their weight, their height, and head circumference. We also measure their
Okay, for the
BMI.
head and neck physical assessment, the head we observe the size, shape, and symmetry of the head, check for scalp lesions, hair distribution, and signs of trauma. We also palpate for any masses or tenderness. For the neck, we inspect for symmetry and movement, palpate the lymph nodes. We also assess thyroid size and palpate for nodules, and then check the range of motion. For chest and lungs, we inspect, observe the chest shape, watch the respiratory effort, count and then count the respiratory rate and assess for any abnormal breathing patterns. We also then palpate, check for tenderness and the symmetry of chest expansion. We percuss the lung fields and then auscultate, listening to the breath sounds and then noting the presence of like wheezes, rales, or rhonchi. For the heart, we inspect, look for chest wall pulsations, then assess the skin color and for cyanosis or clubbing. Then we palpate, check for thrills and the point of maximal impulse. We then auscultate, listen to the heart sounds, and then note any murmurs or extra sounds. We then palpate the peripheral pulses for strength and symmetry. For the abdomen, we inspect, observe for distension, scars, rashes. We then auscultate, listen to the bowel sounds, and then percuss, listening to like any dullness or fluids or masses, and then palpating, light palpation for tenderness, guarding, or rigidity, and then deep palpation for like the masses. For the musculoskeletal system, we inspect, assess posture, gait, and alignment, check for scoliosis or lordosis. Then we palpate the joints for warmth, swelling, or tenderness. Then we also do the range of motion for the major joints like the shoulders, elbows, wrists, and then test the strength. And then for the skin, hair, and nails, we inspect for color, lesions, rashes, or scars. Then check for hydration and tuger. For the hair, assess the texture, distribution, and if there's lice. We also, for the nails, we look for clubbing, discoloration, or ridging, and then checking the capillary refill time. And then for the genitourinary system, we check for developmental appropriateness and abnormalities. So observe for signs of redness, swelling, discharge, or rashes, and then we palpate. So in boys, we palpate the testes and ensure they are descended. Check for any hernias, and then ask about any difficulties, frequency, or unuresis.